Well, good morning, everybody, and thanks so much for joining us today. I'm Jeff Gold, and I have the honor of being the Chancellor here at the Med Center. And I'd like to extend a very warm welcome to all of you to the Sorrell building here on the Med Center campus. So this press conference is part of the frequent and communications system that we have used to try to bring helpful information to the community and to be as transparent as possible in sharing the current status of what we are doing here at the Med Center, but also to provide some regional and national perspective as well. The two guests we have today were quarantined here in our facility and are going to be able to join their family and their home. The University of Nebraska Medical Center and Nebraska Medicine have been ready and continue to be ready for this. In terms of our spectacular workforce, the partnerships that we've established with the federal, the state, the county, and the city communities that we serve, our world-class facilities, the supplies, equipment, and technology, the testing that we've developed here are absolutely state-of-the-art. Indeed, together, the people you see in this room and many, many others are planning for the future and such additional situations that may arise both short-term and long-term. So with that, it is my pleasure to introduce our first speaker, who is Governor Pete Ricketts, who of course needs no introduction, but just for me to say, Pete, personally, how grateful we are for the relationship and all of the teamwork that's made this possible.
Good morning, everybody, and thank you very much, Dr. Gold, and thank you all very much for being here. So first of all, I want to thank the staff, the facilities here at UNMC, all the great healthcare workers who have been taking care of our guests. They've been doing a fantastic job, and these folks are the experts in the world at taking care of infectious diseases. We have the world leaders right here in Nebraska, and so I want to thank the team that has been working with that. So we want to continue to get that message out to people to be prepared. First of all, just in your daily habits, we want people to make sure that they're washing their hands, avoiding touching your nose and face and mouth and that sort of thing. And then just like any other organization or organization's families, be prepared. And the way I want people to think about this is think about this as a really big snowstorm that is about to hit us. Okay, we all know when we have to deal with a snowstorm that we may have to be stuck at home for a few days and that sort of thing. Well, it's the same kind of thing with this. If you are sick, stay home. Don't go out. Make sure that you're self-quarantining, so to speak. Don't go out and make other people sick. At the state of Nebraska, we are doing the same thing. We are looking at our continuity plans. We're looking to see what we're going to be able to do with regard to this event that is coming at us. And we want to make sure that we're prepared. Everybody should just take this, for what it is. This is, going to be a really bad flu type season if as the coronavirus continues to spread. We see it in other states. We want to be prepared here in Nebraska to be able to handle it. If you're coughing to your elbow or into a tissue, throw the tissue away. Wash your hands regularly, 20 seconds. We want to make sure that you're doing a good washing your hands frequently and making sure that you're just thinking about that good personal hygiene. As you saw, Dr. Gold and I did an elbow bump here, right? So we're just trying to practice that good hygiene so that we can mitigate the effect of the virus spreading.
This morning when I walked in, I met Jerry and extended my hand, and she went and gave me the elbow bump. So you are now the ambassador to America for the new sign of greeting and welcome and friendship, okay? Jerry and Joanne, you're free. Thanks for staying with us, but I'm glad you're well. And we hope your visit was obviously successful, and clearly from the reports I read, the entire University of Nebraska Med System was very generous and kind and welcoming to you, so I hope your experience was optimal.
Amazing.
Yeah, thank you for saying that. I appreciate it. And let me go ahead and thank everybody who has been involved with the care of many Americans who, not through an act of their own will, but ended up here, particularly under Dr. Gold's leadership, and all of you. Thank you so much. We're very, very grateful. Nebraska has stepped up to the plate. We've helped lead the nation in the response to the coronavirus, as the governor rightly said. And we're happy to do it, first with our National Guard facilities being open, and then UNMC being on standby, on watch, ready. Well, I'm very proud, again, under Dr. Gold's leadership and with the leadership of Governor Ricketts, to continue to think creatively as to how we have a surge hospital concept ready for our military, ready for our citizens should there be a pandemic. And again, the University of Nebraska, I think, is very well positioned to help lead the nation in this regard.
For myself, this has been an amazing experience. The way that the staff treated us, you know, friends are saying, oh my gosh, how can you do it? It was seamless. This place is special, and you guys should be very, very proud.
I also agree. It has been wonderful. We've been treated with nothing but respect. I have been in places before that you could be quarantined and when people come in to see you, they act like that they're going to maybe fall over dead in the next few minutes. But that has happened in my lifetime, but this has been amazing, and you all I have a lot of respect for all of you, and thank you.
So great to see everyone's faces, because when we were greeted from the plane coming from Fort Travis, these two faces were there, and we were so tired because it had been such a long, horrendous time getting off the ship and getting from Fort Travis to here. And then these two guys greeted, and it was like, oh my gosh. And we were so upset that we had to come here. We didn't understand. I'm from California. Why couldn't we get off the plane? But this was meant to be, and my husband and I are so blessed. He was the one that ended up in the biocontainment unit because he had a pre-existing condition called Guillain-Barré that had already broken down his immune system. And his treatment is, top. This is the top in the country. Very, very top in the country. You guys are blessed, and we are blessed because of all of you.
But I'd like to underline what Governor Ricketts has talked about in terms of preventing spread, and doing all those things to prevent spread within the community are going to be key going forward. So I'd like to emphasize that point.
It was scary, but being in this situation like this, knowing I can't get out, it's not like jail, and I've never been to jail, but I imagine that a lot more days of this I couldn't take it, I don't think. But it's been wonderful. Everybody has been so kind and good to us.
You know, I woke up this morning and it was like, oh, I should be doing a happy dance. And I wasn't doing a happy dance, I was doing a sad dance. So it's bittersweet.
2 yesterday and 2 today. So 4 of the 15. So we have 11 remaining.
Correct.
Are you anticipating more coming in to the Med Center now? Or?
At this time, today, right now, no. Is that possible? Yes. But we know of no current missions or requests. You know, if there are states or regions, you know, we're still really very much about containment, although I think that's going to quickly change as more and more cases evolve. So if our federal partners asked us to take folks to quarantine, we would definitely discuss that and entertain that. We are the Region 7 treatment center. There are 10 across the U.S., so we are the Region 7 Iowa, Kansas, Missouri, Nebraska treatment center. So if someone in our region wanted to utilize our services, that would also, early in the onset of this pandemic, be an option.
Well, the testing regimens are ongoing now, and so I wouldn't really be able to tell you exactly numbers and dates when they would go home. That all depends on negative testing. But there are potentials that would be able to go home this week, pending negative testing. I think, you know, being around the people who have the infection and observing symptoms, and I think that Jerry mentioned that fever and cough being the most prominent symptoms, that we've definitely seen that. You know, not as much nasal congestion, sore throat, myalgias, you know, GI, gastrointestinal type symptoms that we see with other viruses. So I think that's one thing that we've definitely seen. I'd like to say that you know, the folks who are in quarantine, that they're thanking us, but I'd like to thank Jerry, Joanne, and everyone else for being so cooperative and so gracious, you know, in a situation where they are, you know, very much their freedom's been taken away and been compromised. That they've been very cooperative and very easy to work with, and we really appreciate that. I've also learned that, you know, we mentioned the support that they need during quarantine, and I think we've had excellent support from folks with Nebraska Medicine Behavioral Health, and particularly David Cates running our town hall, giving them strategies for dealing with the situation and helping our staff. And so those are the main things I think I'd take away.
Because we've got a short period of time where likely the cases will exponentially increase. And with no vaccine, then you're talking about a lot of people. And of those, like we've mentioned, a very small percentage will have severe illness or even fatality. But when you look at no one has immunity to it, that's a lot of people. So we just need to be mindful of that and really do our best to implement certain things that would be helpful to mitigate that, which might mean social distancing and perhaps stopping large-scale events and things like that. And I know no one wants to hear about that, but those are the things that are going to be really important to really slow it down in communities where the prevalence starts to happen.
And if we are seeing cases increase, then those are the types of measures that I think we all need to prepare for, whether it's NCAA basketball or schools, churches, other areas where people are getting together. And so that's, I think, the conversations that should be going on now within communities.
I think our public health folks also have great surveillance of what's happening in our community and our state. So we'll continue to rely on those just like we do during influenza season. And I would also just say that none of what we're talking about from a pandemic preparedness perspective should be surprising. We should all be doing business continuity planning day to day in our businesses and in our healthcare facilities, and we should also have a pandemic plan. So this is a potential thing that we always work around. So now's the time to really update those assumptions in those plans and start making sure that the strategies we've identified are going to be successful, given the modeling.
My kids we can talk to on the phone and FaceTime, so that's not been an issue for me. It's just my doggies. My doggies, my bed, and a bath. In that order.
My only question is will my friends shun me when we go back, or just the community in particular? Will they shun us, be afraid of us?
Is it scary to think that? I mean, are you afraid that that might be a perception when you do make it back home?
Our community is wonderful and we're all close knit and everything, but I try to think how I would feel if it were them and they were coming. I don't know. That concerns me. But we'll make the best of it.
I've gotten a lot of threatening hate mails, hoping that I die. Social media, we've had to block. That's been crazy and very disheartening too.
There was a recent report from the West Coast based upon mutation rates of the virus that they actually thought the virus was present in their community for somewhere between 4 and 6 weeks, I think was the number that was published. If that's the case, at a 7 to 10 day doubling time, that tells you there are probably hundreds of people that have either been exposed to or had a minimally severe infection from the virus but could communicate it. So I think those numbers are going to show an uptick across the country, and we shouldn't be surprised if we start to see that.
So really working collaboratively with public health is the goal. So for folks that don't really require admission to the hospital, self-isolating at home is a great strategy, great option. So there's a lot of guidance already out there on cdc.gov website, and local public health departments are really doing a lot to promote that as well. So there's lots of resources and information.
And we've been having discussions as far as if there were, when and if there's community spread, to try to keep mild illness out of the emergency department and to route them to clinics that would be specifically designated to perform assessment and testing for COVID-19, so that we can not, have transmission within our healthcare system. We can separate that flow, give them the treatment and care that they need, the testing they need, and then partner with public health to make sure those test results are followed up and acted upon appropriately in terms of quarantine.
The other thing we do is we screen folks for influenza-like illness, fever, cough, rash, things like that as they enter the health system at all of our front desks. So we quickly invite them to put a mask on if they have any of those.
But this is one of the most caring communities that you would ever want to be in the world.
And the most important thing is that we can feel it.
Well, I'm glad to hear that, because it's palpable to everybody that lives and works here. So with that, ladies and gentlemen, we are adjourned. Thank you.